So I appreciate what you've shared so far. Can you kind of tell us a little bit about your experience with your diagnosis of your
Sure.
prostate cancer and what you've experienced since the diagnosis?
So every year when you're in the military, you get an annual physical exam. And I was 54 years old in 2011 during an annual physical. And the physician's assistant noticed that my PSAs, while they were within normal range, she compared them to previous physical exams and noticed that there was a dramatic increase in the levels of the PSA, even though they were within normal range. And she recommended a biopsy. So in March 7th of 2011, I had a biopsy, and then on March 14th of that, a week later, the urologist called and said, "Mark, we need to talk." Biopsy came back, and you do, in fact, have prostate cancer. You have a Gleason score of 7. So we talked about different options. I went up to the old Walter Reed, the Army Medical Center, where they had a great round robin kind of day where you talk to the radiation oncologist and other doctors. And I decided that surgery was my best option. So I had a radical prostatectomy in May of 2011. A couple of months later, I got the pathology report that the prostate had been examined and was negative at the margins. So I assumed I was good to go and everything was good. And it was for about 10 years. And then during another routine exam, the doctor noticed that my PSAs were not just detectable, but at a fairly high level. I think they're around 0.5. And if you don't have a prostate, you shouldn't have a PSA of 0.5. So he recommended some imaging to see just what was going on. And sure enough, I went and had the imaging, and it determined that I had a biochemical recurrence of prostate cancer. They saw hot spots both in the prostate bed and in the lymph nodes. And then the other thing they noticed is that there were some hot spots around the colorectal area. So they recommended a colonoscopy. And lo and behold, after the colonoscopy, they confirmed that I also had colon cancer. So this presented the doctors with a bit of a challenge, and that they had to treat 2 separate cancers simultaneously. But I am happy to report that after 39 radiation treatments to treat both the colon cancer and the prostate cancer, 9 months of hormone therapy, 8 cycles of chemo over 16 weeks, and 2 surgeries, the prostate cancer is in remission and the tumor from the colon is gone. So very, very grateful for everything that they did.